Hi there, my name's Andrew Terry. I'm a dental hygienist and dental therapist with about 30 years experience now, and I'm also a senior lecturer at the University of Sydney School of Dentistry, where I've been teaching periodontal instrumentation, air powder polishing, power-driven instruments, and also oral hygiene instruction for about the last 10 years or so now, with both the Bachelor of Oral Health therapists, hygienists, and also the dentistry program. So I'm just introducing you today to the NSK Varios Combi Pro 2, which is this little beauty right next to me, or I like to call it the jewel. It's like the jewel in the crown of the NSK oral hygiene maintenance and periodontal treatment with the minimal invasive therapy approach, which is an evidence-based approach based upon the European Federation of Periodontology S3 guidelines for management and diagnosis treatment of periodontal disease, that step-by-step process. So today, just a little brief video just introducing some of the powders that actually go with this particular machine. With NSK, it's a dual function in the sense you have an air powder polishing component on one side with both supragingival and subgingival attachment options, and also our power-driven instrument on the other side with also the various tips that go with that. So the first powder I'll talk about is the pearl powder. So this is a powder which is designed specifically for above the gum line on enamel, on the very heavy stains. So usually I tend to scale my stains from like a 1 as the lightest to almost nothing to 10 being the most severe. And what I'll tend to do is use the lateral surface of a sickle scaler just to sort of test a stain to see how either easily or more challenging it is to remove from that enamel or tooth surface. So this particular powder really is designed for those tough stains. It's a calcium carbonate powder, 54 microns. This powder basically should not be used on restorations. It's really just on a heavy stain on enamel, really, because it is quite a coarse-ish style of stain. Comparing it to a historical version of that, which was the sodium bicarbonate powder, it actually is a little bit better in the sense that it's more spherical design, and also it's calcium carbonate, so it won't affect a patient that suffers from irregular high blood pressure, for example. As we know, sodium bicarbonate, salt-based, salt going into the sublingual membrane of the tongue can elevate a patient's blood pressure. So that's not really an issue with this calcium carbonate powder. So basically, the ideal approach with this particular powder is really that you should be around 3 to 5 millimeters distance from the enamel surface with a heavy stain. And also really, you can use it between a 10 or 60 degree angulation. So with this kind of particular powder, all the powders, you really need to keep moving. I always tend to disclose my patient first before I do air powder polishing as well. Probably done the oral hygiene instruction first as well, before moving on to the air powder polishing. So that is where using, as I said, a 3 to 5 millimeter distance on this particularly heavy stain, and then basically doing our 10 to 60 degree constant movements. That can be up, down, and also from a left to right position. But keep moving. The moment you see that stain being removed from the tooth surface, that's when it's fine to keep moving on to the next element. So we'll do a little brief video there for you now, just to look at the technique on a couple of teeth that I've done for you here in my clinic here today in Sydney.